Welcome everybody. Thank you all for being here so early. We wanted to take some time this morning to give an update on the state's actions to protect Michiganders from the coronavirus. And while there have been no confirmed cases in Michigan yet, and the current risk of getting coronavirus in the United States is low, we must take an abundance of caution to ensure the safety of our families. I'm joined today by Captain Emmett McGowan from the State Police, who runs the State Emergency Operations Center, and I'm joined by the TAG, the Adjutant General Paul Rogers, as well as Dr. Janae Caldoun, our Chief Medical Officer. We must do everything right now to make sure that we are ready if the coronavirus comes to Michigan. The virus has potential to impact nearly every aspect of our lives. State government, our public schools, our businesses, public gatherings and events, and so on. Because of this, I have ordered the activation of the State Emergency Operations Center. Here we will be coordinating with state, local, and federal agencies, as well as important private partners to help prevent the spread of coronavirus and protect Michiganders. Captain McGowan will speak more on what is happening here at the SEOC and the operations in just a few moments. And then Dr. Caldoun will be speaking as well. Because there is no vaccine at this time, we must ensure that everyone knows what precautions to take. This is known, I think, as immunity mitigation and ensuring that we are educating our population and doing everything to prevent the spread. So there are easy things that we can do in our everyday lives. 1, wash your hands with soap and water for at least 20 seconds, multiple times a day. Practice touching your face less often. That is very difficult. You don't realize how much you touch your face, whether you're scratching your eye or you're wiping your mouth, but we've got to be aware. And replace handshakes with elbow bumps or fist bumps is something that we are encouraging. And cover your mouth when you cough or sneeze. The main goal of these efforts is to help slow the spread of the virus. We don't anticipate this will cease the spread, but we can slow it and we can protect especially our most compromised Michiganders. I urge all Michiganders to take these recommendations very seriously and share this information with their friends, family, and coworkers. For anyone who has questions, the Department of Health and Human Services has set up a website, www.michigan.gov/coronavirus. I tried to keep it simple, and that's a place where you can go to get a lot of information. We've already begun taking steps to ensure quick, reliable testing here in Michigan. We now, as of I think 10 a.m. yesterday, have the resources we need to test for coronavirus and have the results back within 4 hours, essentially, is what we anticipate. Previously, we had been sending tests to the CDC and it took a number of days. Now we have cut that in half by setting up testing here in Michigan, and we think that's really important. We've also been in touch with business and education leaders to ensure they're prepared in the unlikely chance that we need to suspend operations at a school or close businesses for a period of time. I want to be very clear. There have been no confirmed cases in Michigan, and the current risk in the U.S. is still low. That's a good thing. But based on what we have seen in other countries, we should expect to see more cases of coronavirus in the United States. And that's why, for the safety of our families and communities, we are activating the SEOC and harnessing resources from across state government to be ready, to be prepared, and to help inform the population. We will hope for the best, but we will prepare for the worst. Just in the event that we need to be active, we will be ready. I'd like to thank Senator Gary Peters for his leadership on the Senate Homeland Security and Governmental Affairs Committee at the federal level during this critical time. He's focused on protecting our homeland, and our teams have been working closely, so we've got a coordinated response to the coronavirus. My number one priority is ensuring that the people of Michigan are healthy and safe. It is our responsibility as leaders to take these precautions as they are necessary and to keep you, the public, informed of what we are doing. We encourage you to take care of one another, talk to one another, educate one another, and encourage smart personal hygiene as we are trying to stave off the spread of this virus. We in state government will continue to work together and keep you informed. And with that, I would like to hand it over to Captain Emmett McGowan to talk a little bit about the SCLC.
Thank you, Governor. I'm Captain Emmett McGowan, Commander, Emergency Management, Homeland Security Division. The Governor's decision to activate the State Emergency Operations Center, the SCLC, ensures a coordinated response from state agencies to address the potential spread of coronavirus as it impacts our state, and it puts us at a heightened state of readiness. The SCLC operation is overseen by the Michigan State Police Emergency Management Homeland Security Division. And we handle the response and recovery efforts as coordinated by state agencies from local government partners as well. The SCLC is staffed by members of state agencies for decision-making, information coordination during disasters and emergencies within our state. We appreciate the Governor's leadership in this effort, and we will continue to monitor this threat as it impacts our state, and we stand ready to respond. And with that, I'll turn it over to Dr. Pilgrim.
Thank you, Captain McGowan. Since the Michigan Department of Health and Human Services learned of the initial outbreak of the new coronavirus in China, COVID-19, our team has been closely monitoring the situation and coordinating response efforts. On February 3rd, the department activated the Community Health Emergency Coordination Center to make sure we are appropriately coordinated internally and with our local health departments and medical providers. We've been supporting our local health departments in home monitoring of people with recent travel to China so that if they do develop any symptoms, we find out quickly and connect them to the appropriate medical resources. Our state lab has been preparing diligently for several weeks, and as of yesterday, as the Governor mentioned, we can now test for the disease in state. We no longer have to send samples to the CDC. This means we will know more quickly if a person under investigation has the disease. We continue to work very closely with our federal, state, and local agencies, and activating the State Emergency Operations Center will make sure we're doing everything we can do to coordinate appropriately. The situation is evolving very rapidly. As of today, there have been over 82,000 cases of COVID-19 confirmed globally and over 2,700 deaths. The majority of those cases and deaths have been in mainland China, where they've had over 78,000 cases and over 2,600 deaths. Outside of China, there have been over 45 other countries that have confirmed cases. In the United States, there have been 15 confirmed cases of COVID-19. There has been some person-to-person spread and spread for close contacts of patients with the disease. We also learned earlier this week that there was a case who may have gotten the disease from an unknown community source. There are currently no persons under investigation in the state of Michigan. The 5 people that we had previously tested for the disease all tested negative. We have had no cases of the coronavirus confirmed in the state of Michigan to date. However, we know that there is currently not a vaccine or an antiviral treatment for this disease. Given that we know it is likely we will see more cases in the U.S., we must do everything we can and use all the public health tools we have to slow the spread. There are simple things, as the Governor mentioned, that everyone can do to prevent themselves and others from getting this virus and other respiratory diseases. Washing hands with soap and water, appropriately covering coughs and sneezes, and staying home if you are ill. Beginning next week, the Michigan Department of Health and Human Services is launching a hand washing campaign specific to the coronavirus, the flu, hepatitis A, to communicate these critical messages across radio and social media. We will continue to work with our partners across the state. We're meeting with universities so they know what to do to protect their campuses. We're working with the Michigan Department of Education as well to make sure schools have the information they need to protect students and staff. We will continue reaching out and working with businesses, community groups, health systems, medical providers, and others so that we're all prepared to slow the spread of this disease as much as possible.
All right, with that, we'd be happy to open it up for some questions. Yes.
So earlier this month, Metro Airport became one of the airports in the country to receive flights from China. What is the coordination between here and Metro Airport as a way to make sure that that is monitored closely?
Yeah, I'm gonna hand that one off to Captain Miguel.
We have district coordinators with the rank of lieutenant from the state police across the state, and that person is a direct liaison to Wayne County Emergency Management, and anything that happens at that level, whether they're meetings, any type of procedures, they're coordinated directly with us here at this office on a daily basis.
General Rogers, did you have anything you wanted to add?
We have been tasked by the Department of Defense to establish a potential site for hosting people who are repatriated from areas of concern globally. That is located at Fort Custer, and we've set aside a facility with a 20-bed capacity. But to date, it has not been activated. To date, we have no anticipation of a need for that facility.
Can you talk about who you may have just on watch at this point, who's been, advised to self-quarantine, who's recently traveled back from China maybe?
So we have had over 350 people that have come through the Detroit Metro Airport, and we funneled the information for those travelers to our local health departments, again, monitoring them for symptoms. To date, none of those people who have traveled recently to China have developed symptoms so that we needed to escalate. But we continue to have that system where we on a daily basis are sending information about those travelers to our local health departments for follow-up.
Is there anything you're recommending on preparations in terms of like masks or supplies?
We're working very closely with our medical providers and our hospital systems. We've had several calls with them, telling them to again, dust off their flu preparedness plans, making sure all of their staff are appropriately trained. And again, they do this every day at hospitals as far as mask and isolation. So we're working with them to make sure they understand what to do if a potential case comes to their doors.
Governor, can you talk a little bit about the importance of calm in moments like this? The market's way down, people are getting on edge here. How valuable is that in this situation?
Well, we want to be clear-headed. We want to make sure that we're disseminating information so that people can have confidence in the work that we are doing, and so that people know precisely what actions they can take to protect themselves and their families. And that's, I think, very important. We have not held a conference until now because we thought it was important that we've got everything ready to go and we can share information and be completely transparent about where things are and what we are anticipating. And that's, but let's be very clear, the vast majority of people can take into their own practices ways to make sure that they've mitigated the spread of this disease. So that's what this is all about, and being clear-headed and calm and sharing information, I think, is the most responsible way that we can proceed and protect our state. Karen?
I'm wondering what kind of communication you've had with school districts about should there be a confirmed case in Michigan, what would be the procedures for school closures? And I'm also wondering who in the state has the authority to close schools, if that would just be each individual superintendent, or if that would come from the health department or the governor's office.
Sure, we're working very closely with Dr. Rice, our state school superintendent, to make sure we're getting communication out. Actually today, we're sending it out through the Michigan Department of Education. We're working very closely with the schools. It may be different district by district and school by school, so we'll have to take it on a case by case basis, but absolutely we're letting them know basic things about how people can protect themselves and to be ready for if they need to close schools, what that would look like for each individual school.
We'll take just a couple more questions and then we'll go out into the SCLC. We'll start with Casey.
Can you talk a little bit about why now? You said you held off on this for a while now. Was it some sort of concern, elevated concern that brought you to this level today?
I think in the past week we've seen, the spread and first case in the United States that there's not a known connection to the geographic area that originated a lot of this. But I think Dr. Calhoun obviously has been monitoring and staying close, and I think, you know, this was, I take the advice of when we do something of this seriousness with Dr. Calhoun's counsel as well as Captain McGowan, so I don't know if you want to add anything. Dr. Calhoun?
Absolutely, we continue to see more cases across the globe. We did a couple of days ago confirm that there was a case that we're not quite sure how they got it. So I think it's just out of abundance of caution, I'd rather be prepared than be following up after we already have spread. So it's about education and people being ready.
Governor, I have a question. Are you confident in Trump's administration's response to coronavirus?
I will just say this, I am confident in the experts that we have here on the ground in Michigan. And instead of waiting to see what's going on in the federal government, we're going to be in touch with them, but we're gonna make the decisions based on the needs that we see here in the state of Michigan.
All right, last question.
Governor, we've already seen some questionable business practices around the west side, dealing specifically with mask sales. Is the state addressing consumer protection at all through this?
Well, I know that the Attorney General, and I want to acknowledge the actions that she's taken to educate consumers so that people aren't taken advantage of. Anytime there's a crisis, there's always the risk of that. I know that the AG has done a good job of educating the public, and I think that's something to be aware of. We don't want to create a situation where people that have severely compromised respiratory issues can't access the kind of supports that they're going to need, and that's why our combined effort is so important, and working closely with the Attorney General as well.
Thank you, Governor. Thank you,
Okay.
everybody.
Thank you.